The residency in emergency medicine is the top level of the educational pyramid of PRONEM, the National Medical Emergencies Program, which was being developed in Costa Rica up to 1993. The purpose of PRONEM, a 6-year program sponsored by Project Hope and several national institutions, was to establish a global care system to cope with the medical emergencies which are typical of this Central American country. It included the training of over 10,000 persons and created the mechanisms necessary to continue their training in every type of medical emergency. It further developed the infrastructure required for its implementation. PRONEM trained personnel at community, pre-hospital and hospital levels in order to confront the most important calamities of the Costa Rican society during the 90s, cardiovascular diseases and trauma. The residency in emergency medicine lies at the top of the educational pyramid, and this is why it is of such great importance. Historically, the responsibility of the initial care at the emergency services of hospitals has been entrusted to young resident physicians. This is inadequate, since those who come to the emergency services are patients whose lives are in serious danger because of trauma or illness. Good care in this critical area may prevent serious consequences for patients and reduce hospital care costs by avoiding possible complications. The emergency ward must not be a place for greenhorns, but for experienced doctors with adequate training in this field. Furthermore, those experienced physicians who currently stand out in the emergency services are highly specialized professionals, which makes it even more difficult to take care of the emergency in an integrated manner. One additional problem is the lack of a unified command in emergencies, something indeed serious, since decisions in this department must be made in a very short time. In order to overcome such shortcomings, national and foreign experts met and designed a strategic plan. The experts were sent by Project Hope at the request of the Health and Social Security Strategic Development and Information Center, SENDEIS. The plan was broken down into 2 stages. The first one for the preparation of instructors and the second one for permanent residency. Instructors Program. In order to prepare the instructors, a group of physicians was formed and given the tools necessary to become teachers with the capacity to train specialists in emergency medicine. The residency in emergency medicine is organized also on a permanent basis for young doctors who wish to specialize in this field. The idea is to prepare the specialist in emergency medicine. This professional must be capable of stabilizing the patient in only a few minutes, classify her or his afflictions with great accuracy, and refer her or him to the appropriate specialist for specialized treatment. The future teachers must be physicians with a medical specialty and with at least 5 years of experience in the emergency wards of hospitals. They are required to complete 200 hours of rotation in fields other than their specialty. For instance, pediatricians will have to take rotations in gyneco-obstetrics. These 20 pioneers are affectionately nicknamed the grandfathers on account of their extensive work record and experience. The 2 goals sought with the grandfathers are to bring their knowledge to an even level and train them for their educational task. Through monthly examinations, lectures, visits of foreign experts, intensive reading and workshops, the future teachers will benefit from a strong academic preparation under the sponsorship of a U.S. university. The students themselves, whose presentations are evaluated scientifically, teach 2/3 of the 1-year course, the result being fed back to them in order for them to improve their teaching techniques. Project Hope provides an international academic advisor on a full-time basis, finances visits by foreign specialists, and donates textbooks to the participants. With respect to the residency in emergency medicine, several tests are conducted to select the most capable young candidates. They are evaluated by psychologists on the basis of a profile determined by the grandfathers for an emergencies doctor. The students that qualify at the psychological level are examined from the academic point of view, after which the best students are selected. Only 6 students are admitted each year. 4 are from Costa Rica and the other 2 from sister nations of Latin America. They study a number of subjects while they rotate through a diversity of medical specialties. Additionally, they visit large hospitals in the main cities and medical centers at provincial level. The future specialist in emergency medicine is not an internist, not a surgeon, not a gynec-obstetrician, and not a pediatrician. However, this specialist is capable of taking care of emergencies in any of their specialties and applying the required therapeutical measures to stabilize the patient pending final treatment. Upon conclusion of their training, these specialists will be capable of taking care of any type of medical and surgical emergency. In few minutes, they would make an initial and adequate assessment of the patient's condition, provide adequate treatment, refer the patient to other hospital wards, plan the development of policies and procedures at the emergency wards, and would even design research techniques to satisfy the needs in this specific field.
We didn't want to make some sort of copy of emergency medicine as it's done in parts of the industrialized world. That wouldn't have been practical or realistic. Instead, our goal was to adapt and conform to the realities of healthcare in Costa Rica. I believe that's the greatest accomplishment of the Costa Rican emergency medicine programs.
The medical emergency specialist is not confined to the hospital. Instead, through communication systems, she or he conducts and supervises the actions of medical emergencies, assistants and technicians who travel in ambulances if required by the circumstances. This is how the emergency care cycle is strengthened. There is an alert community that knows what to do and whom to call on the phone in case of emergency. There are pre-hospital care units equipped with trained personnel with specialized units which communicate with the hospitals by radio. Here, experts in emergency medicine give them instructions and prepare themselves to take care of, stabilize and refer the patients to the pertinent specialties. After the initial treatment, they are transferred to intensive care units or a ward. Later, and after a general rehabilitation, they are welcomed again by their relatives into the community from which they had once left. The residency in emergency medicine is a prime importance link that consolidates the national medical emergency system of Costa Rica.